Okay, good morning. Good morning. All right, let's wake up the way. Okay. Welcome, everyone. I'm thrilled that you're all here because today we're diving into one of the most exciting innovations in the insurance world. We all know cancer insurance has existed for decades, but Precision Care by GTL takes a leap forward into personalized medicine. It's not about another policy. It's an evolution in how you can combine insurance and science to empower clients. Over the next few moments, I'm going to show how this product works, who it's for, how to sell it with confidence, and most importantly, why it matters in today's world. Grab your notes because we're going to be covering um, a lot today on how to redefine the way you talk about supplemental coverage in regards to cancer. So let's start with the why. Even with great health insurance, the average cancer patient still spends right around 10 to 30,000 out of pocket each year. Medicare and traditional health plans often don't cover experimental or emerging treatments, the very treatments that can save a person's life. Beyond the financial side, we're talking about clients having to make painful choices, treatment versus travel, hospital versus family time. This product was designed to remove those impossible choices. So when we say outsmart cancer, it's not a slogan, it's about putting science and strategy behind the coverage. Here is where the magic happens. The partnership between GTL and TGen, the Translational Genomics Research Institute, part of City of Hope. TGen is one of the world's leading nonprofit genomic research institutions. They focus on using genetic sequencing to identify how disease behave and how to stop them. By partnering with TGen, GTL built a product that doesn't just pay for cancer, it helps the client beat the cancer. Your clients get access to genomic sequencing and one on one consultation with oncology experts. With that kind of access reserved can be reserved for elite clinical programs. It is now available to all clients through this GTL precision cancer product. So, in breaking down the TGen sequencing, your genome is the body's unique blueprint. Traditional labs look at roughly 400 genes, but the TGen analyzes 19,000 genes. That's the difference between guessing and knowing. The sequencing identifies genetic mutations specific to your cancer, so doctors don't have to match you with targeted therapies, or they can match you with targeted therapies. Excuse me. It's precision medicine, treatment personalized to the client. Imagine explaining to a client this plan pays cash and helps your doctor find the best treatment for your body. That's a game changer, one all within itself. Here's how it works step by step. The client is diagnosed with cancer. They file a claim with GTL. GTL pays for the sequencing directly. The biopsy sample goes to TGen labs for full DNA analysis. TGen experts consult with the client's doctor. A personalized treatment recommendation is then developed. The insured really doesn't have to lift a finger. GTL pays for the science and TGen provides the medical insight. With this integration of financial and medical benefits, it's what separates precision care from any other traditional cancer policies or plans. You, as the agent, you're not just giving clients money, you're giving them time, hope, and precision. Precision Care offers a lump sum benefit upwards of 50,000 paid directly to the insured. That means immediately liquidity. Clients decide how to use it, medical bills, travel, childcare, or rest. So there's no more having to pick or choose. They now have an opportunity to apply the money where it's truly needed. That way they can get the care to help save their lives. And here's where it gets better. GTL adds a 25% experimental treatment bonus for clients who pursue cutting edge FDA or NIH approved treatments. There's also a 25% cancer in situ benefits for early stage diagnoses. You can illustrate it simply. A $10,000 policy graduates to 12,500 payout for qualifying experimental care. This gives your clients choice and control, two of the biggest emotional drivers in any insurance conversation. One of GTL's strengths is flexibility and affordability as well, and the writers make this product even more valuable. They can add the benefit builder rider, which increases benefits for late stage diagnoses and boosts in situ payouts. The annual wellness benefit encourages preventative care with $100 per year for checkups, a subtle but strong incentive for health minded clients. The child care or the child cancer rider is another standout. It covers kids up to 10 grand and gives them access to the same genomic testing that's unheard of. And the return of premium option, it gives clients total confidence. Either they use it or they get their money back. These are powerful upsells that make your presentation stronger and boost your average premium. So, who initially is this product ideal for? Think health conscious individuals, professionals who value innovation, family with a history of cancer, retirees who want coverage beyond Medicare. This is a strong product for clients who value control over their healthcare journey. Also, this resonates with those who've experienced cancer firsthand. They know how unpredictable it is. You're not selling fear, you're offering empowerment and science backed peace of mind, especially for families who cancer runs from generation to generation. And comparing the standard cancer coverage, traditional policies pay a benefit, period. Precision care pays the benefit and gives the client access to TGen research level genomic insights. It's a dual layer approach, financial plus medical. It clearly is unmatched in the market. It's designed for modern era where personalization in medicine is no longer optional. When clients uh, are presented with this option, emphasize that GTL doesn't just cover the cost of cancer, it helps them fight in a smarter way. So here's the difference. Most agents will lead with traditional products. You, if you add this onto your book of business, can lead with innovation. You get to tell a story that's emotional, scientific, and financial all in one. The client will see you as an advisor, not a salesperson. This product opens new doors. Doctors, nurses, researchers, families, wellness communities all become viable prospects. You, as the agent, understanding how to communicate this kind of value, become a trusted partner, not just a policy pusher. Great cross selling opportunity. By now, hopefully, you feel confident explaining benefits clearly. You know how to position precision care with emotion, logic, financial reasoning, talking to people who may have had a parent that passed away, a sibling who's not in the financial position to even cover the diagnoses cost. This is an opportunity to present something that will help them in the financial aspect of being able to save that relative or friend, even. You have the conversation points, prospecting angles, use the knowledge to build trust because when you lead with education, sales flow naturally. Got through this pretty quickly, but thank you so much for being here today. Talking about cancer isn't easy, but avoiding its costs is too much. You now have the facts, the carrier, and the confidence to start having these conversations with purpose. Next steps are simple. If you're not already appointed with GTL, reach out and we'll help you get that set up. If you need quoting support or want to walk through a client case together, we're here for that as well. Let's make sure clients have this protection in place before they need it. Let's make sure you, as the agent, are showing up for them, asking the right questions, learning about their history, really building on that relationship, tapping back into your book of business, and seeing how you can service people with this product. Thank you again, and let's keep the conversation going. Have a good day.